The African Federation of Public Health Associations' involvement in the fight against the antimicrobial resistance in the continent involves three key areas. The first one is making the problem known to as many of the professional associations in the continent as possible, to focus on the awareness raising among health professionals within the continent through their national public health associations, and also thirdly to advocate with governments, regional public health associations, regional organizations like the African Union, UNECA, African Development Bank, and others with whom we are working closely to take this issue into consideration more seriously, so that the expected result will be achieved within the shortest possible time. The fourth and most important area is also the fight against the illicit drugs, against unethically produced and distributed substandard medicines that are widely being distributed within the continent now in many countries. This requires active advocacy against them, and also create some form of a movement to fight against these people in a well-organized manner.
Ecumenical Pharmaceutical Network is a not-for-profit Christian organization whose focus is on promoting access to pharmaceutical drugs, essential medicines, and pharmaceutical commodities. We have 4 strategic focus areas currently. One of them is access to and rational drug use. And the second one, we focus on HIV/AIDS and treatment. Thirdly, building capacity in those who work in pharmacies. And lastly, we focus on information sharing. That's where we share information about medicines, reference materials, and also research that we do. We also, as NGOs, as civil society organizations, have a role to play. We are partners. The governments cannot achieve or overcome a cross-cutting issue like antimicrobial resistance. So we need to work together in collaboration. And in Africa, I think one of the things that I should have mentioned earlier on is really 20% up to 60% of healthcare is provided by churches. And this is the sector that I work with. So we have a big role to play. And if we can succeed, if we can work together, then we can be able to actually succeed on the AMR issues. And this is the only way that because we are providing a larger percentage of healthcare, we can be part of these national plans. We are partners that can implement and contribute at the national level, regional, and the global level.